Last week, I was invited to give a webinar to a colleague's practice discussing autoimmunity and perimenopause menopause to her patients. And many of my own patients were not able to attend, and I've been receiving a number of emails asking where they could watch it. So I figured I'd go ahead and record the webinar myself so that way I could share it with my own practice. So if you're watching this, thank you for taking an interest in your health, and thank you for being here. Now, if you're watching this and you're not a patient of mine, I'm Dr. Daniel. I'm a chiropractor practicing in Austin, Texas, and I've also been practicing functional medicine for, over 20 years now. Much of my work focuses on metabolic health, immune function, hormones, and digestion. But if you know anything about functional medicine, it's not about individual systems, but how everything really works together. And as you'll hear or learn in this particular session, autoimmunity, perimenopause, and menopause are where hormones, the immune system, and inflammation really all collide. There's so many instances where this collision can happen in our life, but it's common to actually show up in our 40s and 50s, and that's what we'll be unpacking tonight. Now, one thing before we start, everything that I share here is education, not individual medical advice. Nothing here is a reason to change or stop a medication, bioidentical hormone replacement. Please take what is useful from this information, this presentation, bring it to your own provider and make decisions together, better decisions together. I hope that by the end of this session, you should really be able to understand the hidden link between your hormones, your immune system, and inflammation. I hope that you're going to be able to walk away knowing that you have far more control and leverage over how this stage of your life can really go. So, with that said, let's go ahead and get into it. Let's start by naming three things that are really all just one connected story. And this is basically the whole talk really summarized in one slide. Conventional medicine all too often keeps these things separate, right? They place them in separate rooms. If you've got hormone problems, you're going to go to one specialist. Immune system problems goes to another. And inflammation, if any doctor names it at all, is going to go to even a third. So you basically get sent down three different hallways for a problem that is really one interconnected story. So tonight, we really want to connect them all. We want to look at why autoimmunity surfaces right now in this window of your life. We're also going to be looking at how hormones, immunity, and inflammation actually talk to each other, and why the real problem is fluctuation, not a deficiency. We're going to we want to learn about reading the signals that your body has already been giving you for years and try to make sense of what that means. All these signals that you've been getting. Then we want to get into some practical things. So, I really hope to be able to share a few things that you can start doing today, this week, to address it. And I think importantly, how you can partner with your provider to test the right things and read them the right way. Now, if you take anything from this webinar, please let it be this: measure your baseline and build your foundation. Everything else is going to hang off of that. So measure your baseline and build your foundation. Now, let's talk about the pattern that nobody names. Let me start with the pattern that almost no one is going to say out loud, but it's there. We know it exists. Approximately 80% of all people living with an autoimmune condition are women. And that's roughly 4 out of 5 autoimmune conditions that exist in women. And women do not develop these conditions evenly across their life. They tend to cluster at very specific windows. The times when hormones are really shifting the most. So this includes puberty, when she starts menstruating, or the onset, right, of menses, pregnancy, and the months after, and even multiple pregnancies. And then the one that we're going to be discussing tonight or today, the menopause transition. Now, there's no clean number for how many of these cases are caused specifically by the transition. Unfortunately, there's just so much research that still needs to be done, especially on female physiology and especially on something as complex as her period. As much information as we have and as much science as we have accumulated over these last hundreds of years, we still know very little, unfortunately, about her physiology. But the pattern is very real and it is well documented, and the mechanism behind it makes sense. So let's talk about that for a minute. What the data actually shows. So here are the numbers that can hold up. As I said, approximately 80% of autoimmune diagnoses are in women. Rheumatoid arthritis has its peak age onset in women between 45 and 55, which is right at the top of perimenopause. Lupus tends to peak even earlier, between 40 and 49, again, in the perimenopausal years. Then you have Hashimoto's, which is one of the most common and missed autoimmune conditions, with 17.5% in women compared to only 6% in men. Now, remember, these are onset peaks and risk associations. They're not proof of a single cause, but the timing clusters around these stages of life, such as puberty, pregnancy, and menopause. Now let's talk a little bit about autoimmunity and how it is a threshold, right? Autoimmunity is a threshold, not a switch. So why does autoimmunity show up at these very specific windows or phases in a woman's life? Why does it show up when she starts to menstruate, or during pregnancies, or during perimenopause menopause? Well, first, autoimmunity almost never comes from a single cause. I know everybody wants to know the root cause, but really there's no root cause, there's root causes, and it's multiple factors. As you can see here from the slide, it comes from an accumulated burden. So think of a bucket, right, that you've been filling your entire life. The genetics that was passed on when you were born, that's the first part of what filled your bucket. And there's not a lot you can do about it, right? It is what it is. It was given to you from your parents. Then you have the years of stress, poor sleep, blood sugar problems, blood sugar swingings, gut problems, infections, environmental exposures. All of it kept adding into your bucket a little bit at a time, right? And for the most part, for most of your life, you've probably had enough room to spare. But when a major event, something like your period starts, there's fluctuations in hormones, or when you get pregnant, fluctuations in hormones, or perimenopause, arrives. And that could be like pouring a big new stressor all at once. And for a lot of women, for a lot of you, that is the moment that the bucket finally spills over. And this is the reframe that I want you to hold on to. Your condition did not just come out of nowhere. The same way that like hormones just don't decide to become imbalanced. They don't just go out of whack. The bucket has been filling for years, and perimenopause was simply the pour that pushed it over the edge. It's pretty much what happens. But the good news is that you can absolutely change or do things to empty the bucket. And you can do things to build your reserve. You can actually do things to make your bucket bigger. And so, that's the good news right from that. Now, this is known as the cumulative load of autoimmunity. And, here's that same idea that I just described across your whole lifespan, just in graphical form. And this is my favorite way to really see it. And you can see here on the graph, over on the bottom, you can see the stages that your life goes through. You can also see two lines moving, right, in opposite directions throughout your life. The bottom purple line that is rising over time represents your cumulative load, your total burden of stressors. climbing from birth onward. And then you have the yellow line that is falling. That is your regulatory reserve, your capacity, how much you can handle, your body's capacity to keep the immune system in check or balanced. And that reserve is made of things like maintaining stable blood sugar, muscle mass, strong immune barriers such as your gut, your detox capacity and overall toxicity burden, your adrenal buffer, which you're going to learn is extremely important during menopause. Now, at birth, again, like we said, your genes and your microbiome, set the stage, right? Set the floor. That's kind of the bottom, preloaded software. Again, these are things that you were given right from the start. But childhood can be different for everybody. Childhood trains the system. Depending on how you were raised, where you were raised, the environment you were raised in, then you move into puberty, which is really the first major hormonal stressor, right? It's a stress test. Then you progress through your reproductive years, right? Whether you had one pregnancy or multiple pregnancy, but the load quietly climbs, along the way from childhood up until pregnancy. Again, there's decades of dietary changes, dietary influence, stress, toxins, like I said, pregnancies, all of this pouring in until finally those two paths cross. Your resilience or loss of resilience and your burden, right? The increase of that. Those two paths cross, and that's the threshold. Again, autoimmunity is not a date on the calendar. It's not like a ticking time bomb that just went off. It is the moment that the rising load, that line crosses the falling reserve. That's it. And that can happen, early in life. It can happen middle, or it can happen later. Right. So again, it just depends on the individual and all the accumulation and also their reserve, their capacity. And for so many women, that crossing happens when they first start menstruation. Unfortunately, it mostly goes undetected just because it's not on a doctor's radar to think that, a 13-year-old or 14-year-old or whenever you started that you're going to have autoimmune issues. I think it should be because the data is pretty clear about it. But then when she gets pregnant and, that's a stressor, a lot of times that'll be the time when you identify, that there's an issue there. And then finally, there's another window at perimenopause when the burden is actually at its highest and the reserve is probably worn thin at the same time. Estrogen starts swinging just as the buffer is running low. And this leads us to the autoimmune triad. I think this is a very important slide for people to understand. Anybody with autoimmunity, the autoimmune triad. So what does it actually take to develop an autoimmune condition? There's actually three things that really need to line up. Number one, there's genetic susceptibility. And this is the loaded gun, again, that you were born with. If you're female, the fascinating piece of why women carry more of this risk, why 80% of the time, you're going to identify that it's in a woman, is because of her genetics. The X chromosome, huge. The X chromosome is packed with immune genes, loaded with them, more than almost any other chromosome. And women have two X's. And even though one is supposed to be switched off, the silencing is often incomplete. A meaningful fraction of those immune genes on the second X actually stays active. So women run hotter. And at that higher dose, it's just going to compound. And there's newer research showing that the molecule that does the silencing can itself become a target of the immune system, which is what autoimmunity is, when your immune system learns how to attack itself. This is the active science, and it's not settled, but it is a real part of why these diseases are so lopsidedly female. Second, there has to be a trigger. There's always going to be some kind of noxious external, stimuli, something that sets it off. And the most common categories of triggers can be organized as dietary triggers, chemical triggers, infectious triggers, and then there's lifestyle triggers. Now, for dietary triggers, some of the more common foods are going to be corn, soy, gluten, and dairy. Now, this does not mean that everyone has problems with these foods, right? It doesn't even mean that all autoimmune patients have problems with these foods. It's just a known relationship, and it's a very strong association. And so it should be on your radar. If you've got autoimmunity, stop eating corn, soy, gluten, dairy for a period of time and see how you feel. There's a good chance that that could be a trigger for you. Chemical triggers. Chemical triggers can come from industrial chemicals or household chemicals. And then a big one is cosmetic products. And of course, women are far more exposed to cosmetic chemicals than men. Just take a look at your bathroom cabinets, right? Your sinks, and compare the man's sink versus the women. I mean, you're typically going to see a lot more products, that are just there. There's infectious triggers. This includes bacterial, viruses, parasites, and fungal infections. And then finally, there's lifestyle factors such as fitness, stress, drugs, emotional health, just the lifestyle factors, right, that could be influencing you. The third and most important of the triad is going to be your barriers. Now, every human being has innate immune barriers that are designed to not just protect their body from the outside world, but allow for a safe integration with it. I think that's important. A lot of times when we think about the immune system, we think about just our immune system attacking or defending. But the reality is we are very much part of this world. The fact that we started looking at ourselves as separate from nature, that's one of the first human wounds that I would say created dis-ease. But we are part of nature, and our barriers are here to help us integrate successfully. Now, the major barriers include, your skin, right? Your skin protects you. Your ears, eyes, nose, throat, your lungs, your blood-brain barrier, and then the most popular, which is your gut. Leaky gut, right? When the gut barrier becomes disrupted, we call that intestinal barrier dysfunction or permeable barrier or leaky gut. But it's not just your gut that can become permeable. You can also have leaky skin, acne, psoriasis, too much oil, right? That kind of stuff, just reactivity. You can also have leaky nose, allergies, chronic sinusitis, leaky lungs, asthma, and respiratory conditions. You can have leaky brain, which is brain fog and mood disorders. And then there's leaky gut, which leads to food allergies and sensitivities and intolerances and inflammation that also drives leaky brain. And so once these barriers become disrupted, your body loses itself and the immune system becomes overloaded. So much so that it starts to make mistakes. And that's what autoimmunity is. It's when our body mistakes itself for the enemy and goes on the offense and starts to attack itself. Now, here's the leverage. And this is the whole point. You cannot change your genes, right? You can't do anything about that. That came preloaded, thanks to mama and dada. But genetics is the loaded gun. It's not the finger that pulls on the trigger. We now know that diet and lifestyle has way more influence on our body, and it can affect the way that our genes are being expressed as well. So you absolutely have power, over the other two, over controlling your triggers. You can change that. And you can also work on healing the barriers. But even with your genetics, let's just say you were given bad genes, through your diet and your lifestyle, that changes your epigenetic expression, which helps to overcome that. And that is where your power is, right? And so it's very important to remember or hold on to that. And this leads us to the next topic. What stage of autoimmunity you find yourself in determines how easy it will be to correct it. So the stages of autoimmunity are also important to bring up. And this might be, honestly, the most important slide because it predicts prognosis or success. Autoimmunity has stages. In stage 1, the silent stage, antibodies can be present, but there's no symptoms and no real damage that can be observed. Then you get into stage 2, which is the reactive stage, where antibodies start climbing and symptoms start to arrive. But the standard test still reads normal. You may have symptoms, but the day you tested, your antibodies were, they weren't elevated. They were not there, because antibodies can go up and down daily. And this is why it's important to not simply treat a lab number, but take into account the full context of a person's lived experience. Unfortunately, so many women will never be properly diagnosed because their doctors don't understand this process. So eventually they pass into stage 3 when there is finally enough measurable damage that the body is so inflamed, she'll get a name, a label, and a diagnosis, finally. Now, this is the problem, right? Conventional medicine, all too often, like many other chronic health conditions, waits for stage 3. It waits for the damage to show up, but the window where you can actually change the trajectory most meaningfully is in stages 1 and 2. And that window can last years. Now, again, there's a lot of preventive medicine, but it ends up just being, diagnosis, like you're just capturing an image. When most of the prevention should really be happening from the identification of patterns and listening to your story. That's something that's just missed in conventional medicine, but it's also not their fault because they weren't trained in that. And so, here we have a problem where we're not using the right method in order to understand it. Now let's slow down a bit and name what stage 2 actually feels like, because I think some of you are living in that right now. Stage 2 can feel like exhaustion that, sleep doesn't fix. It can feel like brain fog, where you're just like, gosh, my brain's just fuzzy. It just doesn't work, right? Like the words are just out of reach. You forget things that you shouldn't forget. You can't think as fast as you used to, or how fast you should be able to think. You've got excess weight that just doesn't come off. You're puffy. Anxiety just pops up out of nowhere. It can pop up in the middle of the night. So you go to your doctor and you tell them how you're feeling, and they order a standard lab workup, and your labs come back, and what happens? You're told everything is normal, right? Looks pretty good. Maybe they refer you to a psychiatrist, which is unfortunate, and that happens. Maybe you're just stressed and you're depressed and you need an antidepressant, right? A stimulant. Now, I need you to hear this clearly. Normal labs means you're not sick enough to diagnose yet. That's basically what that is. It does not mean you are healthy. Normal labs means your results fall into the average across the US, because that's what that is. The report is an average of the United States. And the average person in the US is not healthy. So normal labs does not mean you're healthy. And that fog, that fatigue, it's not you being dramatic or lazy. Those are symptoms that are real, and they are very often the earliest signal that we have. The fog in particular, the brain fog, is inflammation reaching the brain, activating the brain's own immune cells. It's physiology. It's not a character flaw. You're not lazy. My entire job is to catch this stage early while the system is still changeable, while you can still do something about it. When you get into end stage, it makes it very difficult. So, speaking of change, let's talk a little bit about hormones in perimenopause and what's going on here. It's not deficiency. Let me just say that right now. It is not deficiency. A lot of times people think that, like, as you're approaching, over time, as you age, your hormones are going to go down. That's not true. One of the biggest myths in this whole conversation is that hormones decline as we age. Most people believe perimenopause is an empty tank, right? Like your hormones are gone. Estrogens run out. So you just, all you have to do is top it back up. But that is not what is actually happening, especially in the years leading up to menopause. In perimenopause, estrogen is not simply low. It is erratic. It spikes, it goes up really high, and then it crashes. In fact, your estrogen can swing higher than it ever did your entire life during this period. But it can also drop off a cliff, sometimes, within the same week. And here's why that matters so much. Every one of those swings, these huge ups and downs, triggers a wave of inflammation. Every single one of them. And estrogen acts as a hormone signal. Every immune cell in your body has receptors for estrogen. So when estrogen shows up in full force, when you have this huge spike, you activate those cells or those immune cells. And you have these ups and downs, right? It's a quick way to frustrate your immune system. And this is why this stage does not feel like just some tiny little problem. It feels like your entire world is unraveling. It feels like your gut, your joints, your brain, and your mood. Everything is just red alert, right? Everything firing off all at once. But it's because of these huge spikes and these huge falls. Again, it's not in your head. It's inflammation responding to the volatility of what your hormones are doing. Now, another quick word on an important marker to measure, which is FSH, follicle stimulating hormone. Follicle stimulating hormone is one of the hallmarks of perimenopause menopause. It's when your FSH starts to rise, that's a strong sign that you're transitioning. And some of you might have been told that a high FSH means high estrogen, but not quite. High FSH means your pituitary, your brain is working overtime, sending the signal, cranking harder to get a response out of your ovaries that have become unreliable. That's what starts to happen, is the ovaries are pretty much just going to stop producing. And so FSH is released in order to tell your ovaries to release more, right? That's pretty much what ends up happening. Sometimes that produces a huge surge, and then sometimes there's a crash that follows. So the high FSH is really the alarm bell that the system has become erratic, which is exactly the problem that we're describing. So, the jagged line that you see here on this slide, that's the perimenopausal reality. The steady line is what a stable supplied level looks like. And this is what your body's designed to do when you get into this period of your life. Your adrenal glands, which produce hormone, they act as a buffer. They start to release hormone to keep things steady. But the reality is most people, especially people living in a modern world, their adrenals are stressed out, they're taxed, they're overburdened. So it doesn't work that way. We can use hormone therapy, right? This is exactly why hormone therapy helps the women that it helps. It's not topping up an empty tank. It works because it's flattening the swings, because you're getting steady hormone, so you're not having these huge, gaps, right? And there's other factors, again, that can help flatten those swings, which we're going to get into. But because, again, we'll come back to that, but hormone replacement can help. But there's also many people who need to be cautious with it. So that's why I don't like to just lead with it, right? There's a lot of things that we should actually be working on before we get to that. It's beneficial, it's useful, but it's not where I would start for sure. Now, why do some women sail through this transition and others crash? I mean, we all know someone, right? You probably know two women the same age who've had completely different experiences of perimenopause menopause. One barely notices it, while the other felt, like she was coming apart, like literally unraveling. Same transition, but two completely different outcomes. And a big part of the difference is that buffer that I just described. So your adrenal glands can make hormones too. And they they most certainly step in to soften those ovarian swings. They're like shock absorbers. And if you go into this transition with healthy, well-supported adrenals, good sleep, you're managing stress appropriately, your shock absorbers are going to dampen those huge swings, right? It basically softens it, and the ride's going to be much more smooth. But if you come into this time of your life depleted, which, let's just face it, it's very common, right? Living in our current environment, running on years of chronic stress, short nights, the shock absorbers are pretty much worn out. You're going to feel every single bump, right? Your adrenals have had it, you're nutrient depleted, your gut is disturbed. The inflammation may not fully settle even after your estrogen finally stabilizes, if you come into this. And so, there's so many things to think about leading up to it. Now, this is exactly why I talk about managing stress. And when I talk about it, I do not mean it as a soft suggestion. In this window, your stress load is not just a mood. It is literally physiology. It is biochemistry that is contributing to pathology, causing problems. And it is one of the highest leverage things that you can change. You can't out-supplement or out-medicate your stress, but there's a lot of things you can do to really work on this. So, someone who's lived a stressful life, if their adrenals are taxed because of it, it increases the odds of having problems during this transition. A lot of times people will think like, well, gosh, perimenopause, menopause seems like a design flaw in humans. No, our bodies are perfect, amazing. You've got this whole system that is meant to, your adrenals are like a backup generator to your power grid. And when the power grid starts to sputter, you've got your backup generator to come in and save the day. The design flaw is how we're currently set up to live. We live in cities and modern life. This is our zoo, and it's created a lot of problems, unfortunately. Now, another important thing to consider is that your history predicts your transition. Here is something that surprises almost everyone. Your transition is, to a real degree, predictable. I could look at somebody's life. If they shared it with me, I could look at, when they started menstruating, how they lived throughout that life, through their pregnancies. And even though they haven't hit the transition of perimenopause, I can predict whether they're going to have problems with it or not. Think of it like this. Your periods, right? Your periods have been writing you a letter every single month for 30 years. Perimenopause is that same letter, but now written in capital letters with more veracity, right? It's just, it's coming at you full force. So, read the letter and address it ahead of time. Read it monthly. If you're listening and still menstruating, right? If you're listening to this talk and still menstruating, these letters, that's your vital sign. If you have brutal PMS or PMDD, that points to a sensitive, inflammation-prone system. And it often means that when you hit perimenopause, you're going to have a rough ride on mood, sleep, and anxiety. At least that side of perimenopause. If you have or had heavy periods, that usually points to estrogen dominance or sluggish clearance. Maybe enough estrogen, not too high, but you're not clearing it. So it acts as if. And that tends to mean bigger, longer estrogen spikes during perimenopause. If your periods are very painful, that points to a high inflammatory load and more inflammatory transition. And if your cycles were irregular, well, that really just points to some other system that's creating a problem. This could be like your blood sugar, thyroid, your gut. It makes usually the transition harder on your metabolism. Again, the transition mostly amplifies the terrain that you already have. And that terrain, your blood sugar, your stress reserve, your baseline inflammation, your gut, your nutrient status, all of it is modifiable. And if you can learn how to read the letters that you're getting ahead of time, you can change the ending. And I think that's the good news, right with that. Speaking of change, let's get into a few things that you can work on. So what I like to call buffer, clear, and calm. Now, you cannot stop the ovary from sputtering, just like you cannot or should not prevent your menstrual cycle from starting. It's a phase of life, right? It is what it is. It's part of our biology. And that part is not yours to fix, not at all. But you can do a lot of things, 3 things, that I'm organizing here as buffer, clear, and calm. Let's talk about buffer. Buffer the swings. This is where we support that adrenal shock absorber by optimizing sleep, going to bed and waking up at the same time. It's more important to wake up at the same time every day, Monday through Sunday, getting light early in the morning. Those light dark cues send signals to your brain that influence your hormones and actually set you up for proper sleep. Stress, right? Stress work, doing that diligently and consistently and not just thinking about it. Correcting nutrient deficiencies. There's also a category of nutrients, supplements, plant compounds, also foods, called phytoestrogens. And this is where it earns its place. Used well, phytoestrogens behave like a buffer right at the receptor. They basically take the edge off of a spike and gently prop things up on a crash. So kind of like taking hormone replacement, right? When you take estrogen, it activates those receptors and it keeps those swings from happening. However, estrogen's very potent, and there could be other factors where when you're binding those receptors with hormone, it can cause issues. So if you're in a spot where you can't use hormone, phytoestrogens are not as potent as estrogen, but it can have the same effect, right? So that's really good. And then for the crash side of mood or sleep, if you're just having a hard time sleeping, despite having good sleep hygiene, then certainly consider progesterone, which is a real tool to think about. Progesterone is safe, which is different from progestin, by the way. That's not the same thing. Progesterone, micronized progesterone, taken orally, is very safe. That's something to consider, and I would bring that up, as something that can help you. One firm rule before anyone runs out to buy anything: if you have a personal or family history of an estrogen-sensitive cancer, if you're not clearing or detoxifying hormones properly, this includes phytoestrogens and hormone therapy, it really becomes a screen-first, individualized decision, no exceptions. If your body's not clearing hormone properly, then adding more hormone, you might feel better, but under the hood, things are not going to go well. So again, make sure you know what you're actually doing. And this brings us to why clear is part of this. Clear hormones better. This is about helping your body process and remove estrogen efficiently. And you can do this by supporting your body's natural detox pathways. Now, you hear so much about detoxification programs, but the reality is your body naturally detoxes. You've got systems that run through the liver, through the digestive system, your kidneys, and by stabilizing blood sugar and insulin, because high insulin tells the body to make more estrogen, basically. It also contributes to inflammation. These are all systems, your detox pathways, that are influenced from nutrients, from a number of factors. These are all things that you can work on. So, by supporting your detox pathways, you basically lower the spike at the source, and every swing gets smaller and smaller. So that should certainly be a part of it. Finally, do things to calm the inflammation. So, each swing does less when it happens, basically. A big one here is omega-3. Get your omega-3 number right. When I test patients' blood, the average number of omega-3s, it's a percentage, it's 3 to 4% in their blood. That's the average that I see in my practice, when it should actually be 8 to 16%. That's a huge difference, right? And that alone helps to control how your body handles inflammation. You could have two people, twins, that are exposed to the same stressor that causes inflammation. If one of those twins has an optimal amount of omega-3s, even though it's the same input, their inflammation is not going to be the same. The one that has optimal omegas is going to have a lower response. And so that's why that's important. Following an anti-inflammatory diet, identifying your dietary triggers. Do you have food allergies or sensitivities? And it may not be so bad to where you get major symptoms, but there's ways to peek into that and see if your body's responding negatively to foods. But that can contribute to inflammation just through your diet. And then, of course, supporting nutrients that play a role, such as vitamin D, vitamin B6, extremely important, and then magnesium. These are the basics, right? Nothing I just described is fancy. And I hope I'm not disappointing you because of that. But the truth is, these are the foundations. And foundational work is extremely important. Everything rests on your foundation. I mean, we all understand that, right? If you have a crappy foundation and you build a house over it, it's not going to be a good investment. There's no point in spending money on fancy, shiny objects, the latest and greatest, if your foundation is crappy. It's just not going to work as well. So foundations first, always. And again, I just gave you a few things that you can work on, but and there's a lot to unpack with that. But let me be very clear about sequence, because order matters more than people think. And especially in functional medicine, people go to functional practices, and I've seen the workups and all the things that were recommended. And a lot of times people are just getting everything thrown at them at the wrong sequence. It's just silly. It's like nobody builds that way, right? You don't build foundations that way. You don't build a house that way. Foundations come first, and roughly in this order. Blood sugar is number one, because it is the quiet amplifier behind so much of what is happening in our body. And it is the single most modifiable lever that you actually have. Then you've got sleep, because that is when your immune system resets and clears the day's inflammation. Sleep is extremely important for the preservation of your brain's detox pathway. So, extremely important to be optimizing that. Stress load, because that is the adrenal buffer, right, that we talked about in practice. And then your gut health, because you simply cannot calm an immune system that is being fed antigens, proteins that are, passing through a leaky gut, causing your immune system to go haywire. It's just not going to happen. So those are the things. It's very difficult to heal and optimize for autoimmunity if you have poor blood sugar regulation, if you're not sleeping well, if you're stressed, centers are not functioning, and then finally, if your barriers are broken. And one honest word on supplements, because this is big, right? Some are genuinely useful, and I use them every day. I recommend them with patients, but I do it in a targeted fashion, right? Supplements support a strong foundation. They do not replace one. And anyone selling you a set of pills or a single pill as the whole answer, that's retail. That's not health, right? Because the reality is if you're going to be taking something, there needs to be specific mechanisms that have been identified. The worst supplements are the ones that you don't need. And to figure out what you need, I'd suggest getting tested and getting tested properly. Now, measure it and measure it over time. Let's talk about this. Something that doesn't get enough attention is how we approach labs or health assessments altogether. Most people simply wait for an annual exam to have a very basic routine lab study, basic set of labs. They're going to get their blood pressure checked, their weight, their eyes. The doctor's going to feel around, listen to your lungs and your heart. That's pretty much it, right? We rely on these snapshots. We rely on a single blood draw, and once a year, maybe sometimes that's all you do for your blood pressure, and you're told everything's okay, and that's it. Relying on a single data point like that is as reliable as forecasting the weather based on a single day. And the fact is, the more data you have, the better the forecast is going to be. And we live in a time where you can now have accumulation of data on your own. I'm a big fan of self-health tracking. You can track your blood sugar using continuous glucose monitors. You can buy a blood pressure unit and track it at home regularly. You can track your nutrition. You can track your blood. There's so much, right, that you can do. And studies have shown this, the annual exam is for the most part, useless unless you've got a chronic disease, like some major condition, that's being worked on. But like I said, the more data you have, the better. You're basically taking out the guesswork. And on top of that, if you don't get the right testing done, you're going to miss stuff, right? So some people get testing done, but it's not the right test. And so they're told everything's okay, but only for what was measured. So, get your baseline. All this data that I'm talking about, that's your baseline. You want to make appropriate changes, get your baseline, make those changes, and then you want to make sure those changes are working. And that's why you're going to retest. And that's pretty much it, right? That's the stuff that you want to be able to do. You want to track this stuff, test, make a change, or come up with a plan, make a change, retest over time to make sure things are working. That's it. A few other things that you need to know. So you can bring up to your doctor. Test beyond the standard panel. First, get your insulin measured, not just fasting glucose and A1C. Insulin plays a major role in inflammation. Ask for a full thyroid picture, not just TSH. At a minimum, you need to measure TSH, free T4, which is how much thyroid you're actually producing, free T3, which is how much available hormone you have, reverse T3, which has to do with stress, and thyroid antibodies to actually see if you have any autoimmune activity. Measure your minerals, magnesium, copper, zinc. The basic panel, they're just going to look at calcium. There's inflammation markers like uric acid, homocysteine, crucial for brain fog. Homocysteine is also important for methylation, which is a detox pathway. Fibrinogen, HSCRP, these are all markers that give you an idea of overall inflammation, not just CRP. There's nutrient markers such as B12 and folate, omega-3s, vitamin D, iron and ferritin. Extremely important to get that measured and not just have the doctor look at your red blood cells and think that everything's okay there. There's quite a bit more from what I just shared, but the point is a basic panel is not enough. And don't ever assume, especially if you're told things look good, you're normal, off of a basic panel, don't ever assume that means you're healthy. Second, remember that one blood draw is a snapshot of a moving target. In a system defined by fluctuation, a pattern over time beats a single number every single time, 100%. This couldn't be more true with hormones as well. If your doctor measures your hormones and bases a treatment on that single draw, there's so much that you're missing. If you go get your hormones measured and told that they're normal, by the way, that's only what happened at that moment in time. And the same can be true if they're low. An hour later, they could be normal. So, hormones fluctuate dramatically hour by hour, and they most certainly fluctuate over the month, right? You know that, especially when you're having your period. Third, push past normal ranges. In range is not the same as optimal. Those ranges were built to catch disease, not to define a healthy, thriving human. So, ask the better questions and then run the loop. Get an objective baseline, like I said earlier, just a while ago, with these markers, right? Get your baseline, interpret them appropriately and come up with a priority plan, change a few things that are prioritized, remeasure, maybe 90 days later. That is how real progress happens with data, right? You're not guessing. So, these are a few important things I think that we should have conversations that you could have with your doctor. In closing, let me bring this all the way back to where we started. What is happening to you in this stage of your life is real. It's physiological. It's not just in your mind. You're definitely not crazy. And it is not something that you simply have to grit your teeth and push through. Your hormones, your immune system, and your inflammation are one connected story. And almost every chapter of that story is something you can influence. So, for many of you, your body has been telling you for years how this is going to go. And for some of you, the way that you feel is actually brand new. And maybe it's because perimenopause, has finally caused you to hit that threshold. But wherever you are, you deserve to feel well and you deserve to function well. So get your baseline, build your foundation. Thank you for spending this hour with me. If you want to take the next step and look at your own baseline, there's a link on this slide that you can see here. That's where you can start. You can schedule a free consult. It's a 15-minute consult. I'd be happy to answer any questions you have. We can talk about your symptoms, the things you're experiencing. If you want to dig deeper, if you just know that this is something that you want to work on and you don't have a doctor that is meeting you where you should be, then consider my functional medicine practice, our services. I'll include a link as well, and we can get started. Hope this all makes sense. Happy to answer any questions.